So, Florence, can you tell us a little bit about where you are now on your cancer journey?
On 3 months break. God forgive me 3 months break. After the 3 months, we going back, which is tomorrow.
And what do you mean 3 months break? Should I ask Dr. Superwood? Okay, Doctor, will you kind of tell us what she means by 3 month break?
So right now, because of the type of cancer, breast cancer Florence has, she completed her 6 months of treatment, and now she's on a close follow-up. So for the first 2 to 3 years, I have to see her at least once every 3 months, and repeat the CT scan once every 6 months for the next 2 to 3 years. So she's on a follow-up for now. That's where she's at right now. She's on a close follow-up where I see her at least every 3 months. However, Florence still finds a way to come in before the 3 months break. But yeah, she's okay for now.
Okay.
Yeah.
And when can you officially declare a patient cancer-free?
So a patient is declared cancer-free when they have undergone all the modalities of treatment and they have been tested and rechecked and there's no form of cancer seen. So for me, I like to use that phrase very carefully. I'd rather say that this patient is in remission.
Remission.
Yes, that's how I prefer to, because with the issue of cancer is there's always that risk of it coming back.
Yes.
That's the reason why they have to be kept on a follow-up. And I always, from the beginning, because when my patients come to me, the first time it's usually a long session because we have to go through that whole motion of from diagnosis to telling them the treatment plan and to tell them that, hey, this is a joining that we're going to be stuck together for at least 5 years, because even after you complete the treatment, you still have to see me. So it's not just treating you and dashing you out to the wind, leaving you out there. So it's a long process, and yeah, I try to, because the issue is you have to keep them on a close follow-up, like I said, because there's always that risk of recurrence. So as long as the on a follow-up, if the cancer does come back or recurs, you can quickly step in and intervene. That's the purpose of the close follow-up of the patients. Yeah.
So the word, for me, I guess I always thought remission was cancer-free, but you use it differently. So for you, remission means what?
So it's like saying the same thing in another way.
Okay.
Yes. Remission, cancer-free means you don't have the cancer in the check. Like I said, you underwent treatment and checked, you were rechecked, and there's no cancer cells seen, so you can say you cancer-free. Another way for saying it is remission.
Okay.
Yeah. So that's it. But like I said, I don't like to use the cancer-free because the issue of cancer, there's always that risk of it coming back. Because in your mind, if you say that you are free of something, that means you don't expect it to come back.
Yes.
So that's why I don't like to use cancer-free. I prefer to say, remission, because with remission, there's that small space that, there's that small space there that there's still a possibility, even if it's 0.2% or 0.1% of it coming back. So at least to, have educate the patient and have in the back of your mind that you have to make sure you check, because if it does comes back, we can catch it early and intervene. And that's the whole point of cancer treatment. The earlier you intervene, the better the outcome.
Okay. Yeah. And I can imagine saying cancer-free would stop someone from coming back to getting checked every 3 months or so, because I'm cancer-free. So if you I think I would see your point. If you use that word, then why am I coming back? You say I'm cancer-free. So I would be hesitant to use that also. So let's talk about recurrence. Can you tell us what that means in layman's term? And then what's the probability or the percentage, if we have any data that tells us of it coming back with the women that you have taken care of?
So recurrence in simple English means that the person went through treatment, the cancer was not there, but then after a while the cancer came back. So that is what that's the whole meaning of recurrence in a very simple way. The cancer came back, even though the person got treated and they told them first that there was nothing there anymore, but then after some time, the cancer came back. The issue with recurrence and the percentage of recurrence is in a simplified form. The more advanced the cancer is from the initial diagnosis, the higher the risk of recurrence if the person achieves remission. Now, let me break it down. Cancer has 4 stages. So it's considered, in general, considered from stage 1 to stage 4. When we bring it to breast cancer, in a simplified way of explaining it, because it's a whole complex thing, but in a simplified way, a stage 1 breast cancer is a cancer that is just right in the breast, nowhere else. A stage 2 breast cancer can be in the breast and probably under the arm, where the lymph nodes are. So the breast will be spread from the breast to the arm, underneath the arm. A stage 3 breast cancer means that the cancer has spread. So it's involving the breast, it's probably involving the arm, but it's also involving like the muscles of the chest. And it will also involve, because the same knots or the lymph nodes that come under the arm, there are a lot of them within the chest that we cannot see. So that's the reason why we do the CT scan and the chest x-ray and what have you to check for them. So if it's involving those lymph nodes inside of the chest or involving the muscles of the chest, that's a stage 3 breast cancer. When it spreads from the breast and goes anywhere else, as in like the lungs or the bones or the brain or the liver, is a stage 4. So considering all of that, and when it's a stage 4 cancer, it can be cured. So that's when we said that the cancer has metastasized. That's the big word we use, meaning the cancer is spread. Yeah, it's gone everywhere, or it's spread somewhere else. So coming back to the issue of remission and the staging of breast cancer, if a person presents with a stage 1 breast cancer that is only in the breast, the chances of recurrence or the cancer coming back is lower compared to a person that has a stage 2 or a stage 3 breast cancer. So the higher up the stage at diagnosis, the higher the risk of the cancer coming back. That's how the whole recurrence issue is.
Okay, so Florence, I wanted to ask you, before your diagnosis, you were one way. You were eating a certain way, you were going out, you were going to church, you were eating what you like, doing what you like. Since the cancer and the treatment, what is different in your life?
The difference now, I don't eat too much pork. I eat fruits, apple, carrot, grape, and some leaves of vegetable. Yeah.
What about your energy? Do you have the same energy? Do you find yourself being more tired, or you feel the same?
I feel this. Sometimes I feel tired. Sometimes I feel good. I used to run, but now I can't run. I have it.
You have it.
Yeah.
And I wanted to just have any of the other physicians, Dr. Cooper or Dr. Jala, chime in about recurrence or anything else you wanted to say to end this segment.
I think that Dr. Superwood said a lot about recurrence and the risk of recurrence. There's only a couple of things that I would like to add. There are a lot of things that you read on the internet about soy milk will make the breast cancer come back, tofu will make the breast cancer come back. As Dr. Superwood said, smoking is a big one. That there's research to show that smokers are more likely to get cancer. People who don't exercise, people who are overweight are more likely to get cancer. But I have not read any studies, Dr. Superwood, you can correct me, about foods. A lot of this is just in the media. It's just rumors about this soy milk, soy products, tofu. A lot of people think that this is what is giving them cancer. There's a lot of things in the media that's not necessarily true. And specifically around recurrence, Dr. Superwood said definitely this word remission. There's something to understand about cancer. She was very careful with her words. She said, you've completed all of your treatment and they've done all the scans and they cannot see anything. The reason that we describe it that way is that cancer can be very, very tiny in a way that it's not visible. In a way that you look at it, you can't see it. Even when you do the scan, sometimes it's so what we call microscopic. Like you have to look under the microscope to see it. It is so extremely tiny that we think it is not there. Then what was so extremely tiny could not be visible. After 5 years, 10 years, it grows back into something that is visible, and that's how it has come back. And that's why a lot of times doctors are very careful to explain that we don't see anything, and we thank God that for now we don't see anything. We continue to check to make sure that even if something starts to grow in the smallest amount, we catch it quickly, we take care of it again before it goes anywhere dangerous. That is something to really understand, that those tiny, tiny things can still exist inside the body, and that is what causes the recurrence. It is very, very rare for someone, let's say, for example, they had breast cancer, the breast cancer is treated, and then the next time it comes back with uterine or womb cancer. No, usually it's not like that. It is usually that same breast cancer that was something tiny, tiny, tiny hiding, and then it started to grow back. And that's why we are so careful. We want to make sure that, listen, let's just keep checking. It's not that we're looking for bad news, no. But if it's there, when we catch it, as soon as it becomes visible, take care of it quickly so you don't get back to this point of having pain and all of those things again. No, we don't want it to ever get back to that place again.
I wanted to ask Dr. Jala this question, and I don't know. In the States, there was a blood test that would tell you your risk for certain types of breast cancer, or that it was in your family. And there were people who were doing elective mastectomies. And I know of a celebrity who did because her mother died from this cancer. Is that something that you are aware of or know of?
Well, what I'm aware of is if they had direct family line, for example, your mother died from breast cancer, your auntie died from breast cancer, your sister died from breast cancer, most of the people will opt to remove the breast just to avoid, because it's direct family line that has the cancer. So to avoid that, that's where I heard about the mastectomy. Maybe you heard about the blood test.
Yeah, so there are a couple of blood tests that you can do. Um, um, like Dr. Chala said, the family history is very important. So, because breast cancer, like I said, cancer is a genetic issue. And there are several genes that have been discovered that are associated with cancer, breast cancer, but there's this one particular set of genes, the BRCA gene, that has really been studied and found to be associated with breast cancer, with ovarian cancer, they even associated with prostate cancer, pancreatic cancer as well. So there are tests, there are blood tests, some blood tests that you can do. Some people go and check. So there's a way that you can check for these BRCA genes. Yeah, so if you check for the BRCA gene and you find out that you have the gene positive, you can go ahead and have the mastectomy done, prophylactic mastectomy. You can remove your ovaries, if you're not having children anymore. Besides that, there are also other tests that in a more advanced world that they can do to check your risks, your level of risks. So they have a couple of them, like the mama prints and what have you. So those ones as well, you can check. They can do your test to know the level of risk that you have with the issue of cancer, breast, family cancer. Yeah, but unfortunately, we don't have them in Liberia.
Dr. Cooper spoke about, we talked about stigma. We talked about how women in Liberia, we have become attached to the breast to the point of maybe even death. And she wasn't making light of that. I worked at a surgical center and I took care of women in recovery room who have had mastectomies, and they've placed expanders in order for implants to be put in at a later date. And then I was there when they put the implants in, Is there something like that available to the women in Liberia? Are there plastic surgeons? Or I'm thinking of a young woman in her 20s and her 30s.
So the issue of surgeries in Liberia. So the first thing first, when it comes to surgeries in breast cancer, it's not all of the time that you have the breast removed completely. So because there's another type of surgery that can be done for breast cancer patients where part of the breast is removed. So all of the breast is not removed. It's called breast conserving surgery. But the issue with that is that when you have this breast conserving surgery done, you need to follow up with radiation. Yes. So unfortunately for us, we don't have radiation in Liberia, so we don't take the risks of doing the breast conservation. So that's why patients diagnosed with breast cancer in Liberia most times just go for the mastectomy, which is the complete removal of the breast. With the and coming back to the mastectomy, having the breast removed, I know that we had one plastic surgeon at 14 military hospital. I don't know if he's still there. He's been there for the last, I think, year or two, because when I came home 2022, he was here. So he has been here. So I think he's doing a little bit of breast reconstructive surgeries. I'm not sure how many he has done, but then I know that we have a plastic surgeon. So that is something the surgeons can look into. I'm not a surgeon, so I can't speak. And I know that there's another colleague who is also currently somewhere in East Africa doing plastic surgery as well. So eventually we'll get there to start doing these reconstructive surgeries.
But I think it's really based on your diagnosis, and then we have to work with the plastic surgeon when we go for the surgery, just to make sure you can't do the surgery, then you send them to the plastic surgeon. You have to have the plastic surgeon on board with you to do the mastectomy and then do the reconstructive surgery. And I think if you want implant, if it's necessary, I'm sure they can order it and get it for you. But you have to pay. But for us here, I think it's easier for us to get the bras that can help the ladies so that they don't look like their chest flat.
Yeah. Unfortunately, something that Dr. Jala mentioned when she first came back is unfortunately still happening though, which is that a lot of women, by the time they get to the doctor, they are so advanced that everyone is focused on saving their life and not saving their appearance at that point. Because when you have somebody who the cancer has moved all throughout their body, the first thing we are all thinking about the medical team, let's make sure she lives. Every other thing we can discuss it afterwards. Let's make sure she lives. And we have been, it's sad to hear that since the time that Jala came back almost 20 years ago, we are still in this place. A majority of our patients, let's make sure they live. We're not even thinking about how well are they living, will they be depressed after they are. We are still at this emergency point of let's just make sure they can live.
Yeah.
And so I think it's up to us to do more advocacy. I think we're slowing down on the advocacy for the people of Liberia. Make sure this mammogram or that every clinic can do a breast exam and report it. Because even with the cancer registrar, I don't think enough people are even reporting what they find. So we need to advocate that all clinics, all women can do their self-breast examination. All clinics can do the examination and know the pathway in which to refer the patient. Because I think patients spend so much time moving around 4 or 5 places. By the time you get to where you need to get to, it's already late. So I think it's up to us.
Dr. Jala is absolutely right. One of the things about it is the stigma of people wanting to stay home because they don't want to tell somebody something is wrong with their breast. But the other part, unfortunately, a lot of women, the cancer is advanced, it breaks through the skin, and for 1-2 years, they're being told they're rising. And they're taking antibiotics here, antibiotics there, and it's cancer. So we have to also educate healthcare providers, the nurses, midwives, physician assistants, and even some doctors to know that this is not rising. This is breast cancer. And even if you think it's rising, if it's on the breast, you better be sure. It's not impossible. It's possible to have a rising or a boil or abscess, as we say in the medical term, on the breast. It is possible, but if it is on the breast, you better be sure that it's not cancer.